How can we use the preterm's well-developed capacity to smell to help them in the NICU? By using breast milk odor to improve oral feeding ability, and by using breast milk odor for analgesia during needle sticks. Breast milk odor can be used to mitigate pain during common procedures that induce pain in the NICU. Shi Zhang's meta-analysis and randomized control trials for Shanwell and other researchers have shown that infants smelling breast milk odor during a mild pain-inducing procedure have lower pain scores, lower heart rate variation, and oxygen variation during the procedure, and continue to have less crying duration after the procedure as well.
So how do you do this? You take mom's breast milk fresh from the refrigerator, warmed up, place about 5 drops on a piece of gauze, and place it, because your gauze is still dry enough, directly on the baby's nose so they can smell it while you're doing venous sticks, OG insertion, heel sticks, IV starts.
It is known that mom's breast milk odor leads to longer and more stronger sucking bursts, and longer sucking bursts implies faster transition to more mature feeds and sucking pattern. Many studies like Hodagoli from Iran, Shrivers from Germany, and other studies in the US have shown that smelling mom's breast milk odor during gavage feedings consistently with greater than 67% of feeds per day leads to shorter length of gavage feeds, faster time to full oral intake, and shorter length of hospital stay. Dr. Jill Marone from Tufts showed that this is especially true of preterms who are less than 31 weeks, whose olfactory genes are undergoing maturation. Studies have linked maturation of the olfactory genes expression to acquisition of suck, swallow, and feeding maturation skills, and this maturation is likely induced by mom's breast milk odor.
You can also use mom's breast milk on gauze during gavage feedings to shorten the length of time for transition to bottle feedings. Remember too, you can use this technique of mom's breast milk on gauze on CPAP babies and on intubated babies.